Boston to speak to Dr. Jarone Lee. He's an emergency medicine and disaster physician from the Harvard Medical School and joins us from Massachusetts. Doctor, thank you so much indeed for your time. We are now almost exactly to the hour, almost 5 days since the first earthquake struck. And in terms of your profession, what are your thoughts about that timeline?
I'll say that, unfortunately, I think that as time goes on, the chances of survival do go down. However, if someone has access to, the basic needs of air, oxygen, and some water, there's always a chance, and a good chance, I think, that to hope and a good amount of hope. I think that, a lot of search and rescue teams think about a 5 to 7 day mark where we might start looking for patients and start thinking about other things. But there's also a lot of stories out there of folks, being rescued up to 13 to 14 days, and sometimes maybe even to 19 days in some of the discussions. And I also want to say that, the search and rescue teams that are out there are very specialized and very well trained, and they know what they're doing, right? They have canines, they have cameras, they have engineers with them, they have a whole team, they know how to do technical rescue. They also have a medical component when they do find survivors so they can treat them in the field. But it is a great team, and all the resources are there to find the survivors.
A lot of people have been complaining that they didn't get the assistance quickly enough, but this is a huge area. We work in kilometers. I know you guys work in miles, but 110,000 square kilometers is a huge area. We're equating it to essentially the size of a country like Bulgaria. What I have understood over the past few days is that when emergency teams first respond, they look at those buildings which haven't completely pancaked, ones that leave, as you say, possibly some cavities for people to survive in. But then what sort of injuries are we talking about when you're inside a collapsed building?
And that's a good point where I think a lot of the chances of survival also relate to what the injuries are when the survivor gets during the initial collapse. And so a minor injury, as you can imagine, will lead to probably a higher chance of survival versus something with a major wound, unfortunately. But again, I'll say that our search and rescue teams are very well trained, including having building engineers to try to think about which pockets of places where the most likely survivors will be so that they can look for them and get them out as quickly as possible.
Is there something that might help a child to survive more easily than an adult simply because of their size, that they might be able to find that kind of gap, that kind of pocket?
Yes, I think that's always hopeful for children to be a little smaller. Also, generally, they're healthier than some of the older adults who might have other medical problems that can exacerbate the injuries or even just not having enough food or water for a short time. So, yes, I think it's more hopeful for younger folks.
Doctor, just finally, in terms of after rescue care, there have been lots of explanations, and none of us are experts in this. You are. But in terms of after rescue care, there's been a lot of explanation from medical experts like you that actually you're not out of danger yet. You could easily die even after you've been rescued.
Yes, and I think that that story doesn't end with the rescue, unfortunately, especially as the time goes on. The folks that are rescued will have more medical needs, including they're probably going to be dehydrated, probably cold with hypothermia, and will possibly need prolonged hospital care to get back to where they were before.
Dr. Jarone Lee, thank you so much indeed, Doctor, for sharing your expertise.